Sydney-siders are about to enjoy all new freedoms from Friday, despite cases rising across the city's southwest. 13 recorded yesterday, 7 of them locally acquired. For more, we are joined by Dr Jeremy McAnulty from New South Wales Health. Doctor, thanks for your time this morning. Is now the right time to ease restrictions when we are seeing cases rise?
Well, we're going to be seeing cases for weeks to come yet, and we've got to get this balance right. So we've got to make sure we've got people coming forward for testing, our ability to be able to find cases and contact tracing, so we get that balance to allow people to get the right sort of freedom while practicing things like social distancing, good hygiene and getting tested immediately should they have any symptoms.
So these clusters in southwest Sydney, are you on top of them?
Look, it's a lot of work, and we have been working intensely with the patients and their contacts and the various venues to make sure that we're identifying those people that are going to isolation, that their contacts are identified and they're going into isolation and getting tested, and we're tracing back to try and find any chains of transmission so that we're not missing any cases. But it's a lot of intense work, and it will only work if we really have the community's cooperation in getting tested and remaining isolated. People should get tested every time they get a new set of symptoms. So one test isn't enough. You know, if you have a test, you recover and then get another runny nose next week, get tested again. There's no limit to how many times you should get tested.
Are you happy with testing numbers at the moment? Are you concerned at all about a fallout from school holiday travel?
Look, we don't think testing is high enough at the moment, and that's why that message is don't be complacent. Don't think what you've got is just a common cold or the flu. It may well be COVID. Assume it's COVID until it's proven not to be, because if we miss even one case or delay getting finding one case because somebody thinks, I'll wait a few days before and see how it goes, that may be more and more people exposed in that time period. So we really need your help to come forward, get testing on the day you get symptoms.
OK, now New South Wales has been the gold standard in handling outbreaks. Is the ICAC inquiry involving the Premier a distraction?
Look, we're just focusing on the job. We've got loads of people here working in New South Wales Health across the state to work with the communities to try and get those messages out, to make sure people are managed and cared for, and trying to stop that transmission. So that's what we're focused on, and we'll continue to be focused on.
And doing a brilliant job at it. Doctor, thank you for joining us this morning. Appreciate it. Carl.
While Sydney is easing restrictions with 13 new cases, Victorians are wondering why they're still in lockdown with just 12 infections. To help break it all down, we're joined by Melbourne GP Dr VM Sharma. Doctor, good morning to you. Obviously, the Victorian situation is different to New South Wales, right?
Yeah, completely different. Despite the fact that the numbers would suggest the number of daily new cases are quite similar, that's a complete illusion. What we've got is Victoria barely managing to maintain the kind of numbers that New South Wales has sustained, but with some very harsh lockdowns. We've got 6 times as many active cases, and the number of mystery cases, those cases where we don't know where the source is, that's a much higher and sustained trend. So people can be tricked into thinking, well, why can't we open up just like New South Wales is? But it's a bad comparison, actually quite a dangerous one that some politicians have made.
OK, so why is that dangerous?
Well, think about the clusters that have happened in Melbourne. We've had an infection go from Frankston to Chadstone to Kilmore, now in Shepparton. Imagine what that would look like if people were able to visit each other inside homes or dine in restaurants. So we're just not there yet. There are some levers that we have not pulled yet that we are starting to. Once we've got that happening, then we can open up safely. Until then, not yet.
OK, so Sydney is going to ease some restrictions as well, as we heard. Is that wise, given all the circumstances, do you think?
Do you know, it's actually not too bad because all the new cases have been linked. They've done a fantastic job of contact tracing, and the openings up are happening in outdoor areas where the risk of transmission is much lower, and there are businesses using QR codes to kind of log customers. So I think it's a good suppression strategy, I suppose, that New South Wales is going through.
My biggest concern at the moment is I don't think people are getting tested, even if they think they've got some symptoms. I think that's why the testing numbers are low, and that's why we've got a false representation of what's actually going on out there.
You cannot get complacent. So it's a huge ask, I know, but people must get tested if they have symptoms. And just like your Chief Health Officer just said earlier, people often think that, I already had a test last month. It's just not good enough. We can catch this bug anytime.
It's skewing the numbers, isn't it?
Sorry, it's absolutely skewing the numbers. Now, the good thing is that what we call the test positive rate isn't kind of shooting up. So we know we're not drastically under testing, but we have to stay vigilant, especially when we are opening up. That's when we really need the testing to be thorough.
Good to talk to you, Doctor. Thanks as always.